Hi, this is Chuck Gallagher. My guest is Valda Ford. You are joining us on this multiple segment program that we have on men's health, especially prostate health. And, you know, Valda, we've already gone down a bit the rabbit hole that I was diagnosed with prostate cancer.
Right. Now, I know that you said you were given a few options. Tell me about those options.
So the doctor came in after announcing, rather matter-of-factly, you have prostate cancer. He said you have 4 options. He said surgery, the gold standard, what I would refer to as traditional radiation. You could do radiation with seed therapy, as I would refer to it in layman's terms, or you could do watchful waiting. Those were the 4 that he gave me as a possibility.
Okay, well, let's get into that a little bit.
Okay.
Watchful waiting, or now they call it active surveillance. So watchful waiting would have been that they feel like you're young, you're healthy, there's a little bit of a chance that your cancer is going to develop into something that might create a problem with your ability to live well or to live at all.
Right.
So they'll just look at it. And some people will just have you come in every 6 months to do a PSA, a blood test, and to check to see what's going on with their prostate by a manual exam. Now, a lot of doctors now call it active surveillance because they're more aggressive than that. They may have you to come in every few months and really pay attention, and every time there's a change, they will decide what else they need to do.
Right.
But again, that's for people who are younger, who probably have less of a chance of it developing into something. But then there's always a discussion with you about what it is that you want to do and how soon.
You know, Valda, it's interesting because I've had a discussion with lots of guys. I was working on a book, haven't finished it. I need to get that done. But dealing with the issues of prostate cancer and things that men just need to know.
Right.
And every time active surveillance comes up, most guys are saying, I've been diagnosed, I want this out. And it's like, okay, although in fairness, I took time before making the decision for what ultimately my treatment would be. There is a, how do I put this? I guess there's an opinion that sometimes we're too aggressive in wanting to make a quick decision on how to deal with prostate cancer when that is, without doubt, disruptive to men's lives and to what happens following from a incontinence perspective, from a sexual perspective, et cetera. So there's a real strong school of thought that if your PSA is above the norm but not crazy, that perhaps at least watching for a period of time would give a better indication as to whether the disease is progressing or it's just kind of dormant and staying in a certain range and keeps a man from making a rash decision. Well,
let's just talk about the numbers real quick since you brought that up. Typically, if you're looking at a PSA of 4, then 4 and above is where doctors go into action mode. And now a lot of doctors are going to start at 3. If you get to where your PSA has been 1 or 0.1, and now it's 2, they're going to start to pay attention. If the next time it's a 3, they're like, okay, let's do some more things. Let's do some ultrasound perhaps. Let's do what's called a, they look at it from the rectum. They put in a probe, and then what it can do is like look at an x-ray through there like an ultrasound.
Right.
And that way it's more specific and can localize things. But what they do is check your prostate manually. If it's fine, nothing's going on, and your PSA is a little bit high, they're going to say, okay, let's see what's going on to follow. If they check your prostate and it's enlarged and it has a lot of nodules that's suggestive of cancer, they're going to suggest to you that you become more aggressive.
Sure. I'm going to make a controversial statement.
Okay.
And we'll probably get some comments on this, I'm guessing, on the videos, but I think sometimes the recommendation that you will receive as a man who's been diagnosed with prostate cancer is going to be a function of the doctor you see.
Oh, that's not even controversial. I mean,
Okay.
as a healthcare provider, I'll have to say that's not controversial. In healthcare, let's just say that everyone goes into healthcare with the desire to do the best possible thing they can for every person. But the honest to God truth is, just like with an accountant, with a gardener, you want people who have the best experience in the most aggressively intentional manner. So you want to go to someone who has had the experience of doing more than one surgery, more than 100 surgeries, maybe 1,000 surgeries, because the science, the research shows us that the more a surgeon provides that surgery, the less likely you're going to have the negative side effects.
Well, and the thing that strikes me as semi-controversial would be, you know, my doctor initially was a surgeon. So, of course, what did he recommend?
He likes
well,
to cut.
surgery.
Yeah.
Because that's his specialty. If I had gone to a radiation oncologist, it's possible that I would have gotten a different recommendation initially.
Possible.
If I had gone to, I'm going to make this really controversial, a naturopath, they might have been far more inclined to do active surveillance or watchful waiting. So to me, as a man, the issue is, okay, perhaps you've been, let me rephrase that. You've been diagnosed. Okay, great. Now, take your time, get multiple opinions, really research what is appropriate for you versus having the knee-jerk approach to making a quick decision that can have life-changing implications.
Well, you said that the best possible way. Take your time, see what's out there, see who you're talking to, and then make a decision based on your life, because it can change your life dramatically. Though now newer treatments, newer surgical methods are going to have less of a disruption going down the road, but the possibility is very strong that you're going to have a disruption at some level.
Sure. So Valda, at this point, to keep our videos within reason, what we'll do is we'll cut this segment short, since it's dealing with active surveillance, and come back and explore the other alternatives that will be available. This is Chuck Gallagher. My guest is Valda Ford. We're talking about men's health, especially prostate health. Stay tuned.